Britain is a country of mass immigration. Last year we issued over 1 million visas to people who wanted to come and live here. We're generally a warm and welcoming country, as long as people follow the proper routes to get here instead of hopping on something that floats and barging in uninvited. The number one rule in Britain is, don't ever jump a queue. Our economy has become dependent on importing cheap labour, and our public services are dependent on importing skilled professionals. But when we look at the impact of mass migration, we tend to just look at the impact in our country. The hundreds of thousands of new arrivals each year puts a huge strain on public services such as the NHS, downward pressure on working class wages, and increases demand for housing, because when people come into the country, they don't bring a semi-detached house with them. There are also issues with integration, with each dinghy bringing young men with medieval ideologies and views on women, gays and freedom that just aren't compatible with a Western liberal democracy. But we tend not to look at the impact of mass migration on the countries these migrants are coming from, probably because we don't live there. A report this week revealed the scale of the brain drain on countries such as Nigeria and Zimbabwe. They're losing skilled professionals such as nurses and doctors to the UK. Now, I can fully understand the incentive for health professionals to emigrate to the UK. Zimbabwe is a country that's falling apart, where nurses make only £120 a month. If they come and work for the NHS, they can double that. But it's had a huge impact. 75,000 nurses have left Nigeria over the past few years, leaving the country with only one doctor for every 5,000 patients. And Nigeria is an African success story with a strong economy and relatively well-funded public sector. Other countries are suffering even worse brain drain. We are stealing the best and the brightest from countries who have invested in them and trained them up. Countries that desperately need to keep these professionals if they're to have any chance of a strong, prosperous, stable future. Also, it might not be the best for us. I'm just saying a medical qualification issued in Zimbabwe might not meet the exacting standards of the West. We're undermining other countries' self-sufficiency and leaving them dependent on our foreign aid. Meanwhile, we're dependent on them for skilled professionals. Now, wouldn't it be a better system if we just had enough children and trained enough of our own doctors and nurses and teachers instead of poaching them from other countries? Then we wouldn't be so dependent on immigration. I've always maintained that the number one route into this country should be through a birth canal. Then we can help other countries modernise instead of stealing their future.